Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is many airports, including Miami, are conducting nose swabs for international travelers. Dr. Raja, why is that?
This is an initiative by the United States Center for Disease Control and Prevention. And what they're trying to do is to put in place a system to track infectious diseases that may be coming into this country, just so that we're better prepared should something happen in the future.
Is it mandatory for all international travelers to participate in these nose swabs?
Actually, no, it is not a mandatory thing. It is a voluntary program. They will set it up, for example, at the Miami International Airport, and passengers, especially international passengers, can opt in to get their nose swabs done. And what that does is this allows the CDC to track what kind of pathogens are likely coming into this country. So right now they're going to track for SARS-CoV-2 and then eventually expand it to tracking of influenza and also respiratory syncytial virus or RSV, again, pathogens that are likely to cause these upper respiratory tract infections. And just looking to see what's coming in and out of the country, can we track these and can we become better prepared? Will we know earlier should something come into this country that is novel and new? Can we be better prepared for it?
Are there any significant results affecting public health in the U.S.?
The main idea is usually the way we track infectious diseases in general are if you have a symptom of a respiratory infection, you'd show up at the clinic or at the doctor's office or at a drugstore to buy a certain drug to help you feel better. And that's where the tracking happens. Oh, are there a certain number of people who are showing up at a clinic complaining of a respiratory disease? Now, what they're trying to do at the airports is it's just an early system of detection. Can we capture it before this becomes a bigger public health issue, before people actually start getting sick? And that's the reason where they want to track these kind of infectious disease. Again, simply because this is the season, the fall and into the early winter or spring months are when you start seeing an increase in the number of respiratory diseases.
How does this directly affect college students?
So if you're a college student and you happen to also travel internationally, say you travel to South America or you travel to Central America or Europe and you're coming through Miami International Airport, you're going to see these stations and you have the option of getting this swab done and kind of helping add to that data in the system to say, yes, I did travel, now did I inadvertently bring back something? You're just kind of helping them determine are these respiratory diseases or pathogens moving around a lot easier.
If a traveler tests positive for one of the diseases being tested, how are the airports handling that?
That's a good question. So right now, the testing is actually anonymous. So basically meaning you're not giving your personal information when you do the swab and the swab gets sent out. So they're counting in terms of numbers, but they're not going to give you an answer in terms of did you test positive for SARS-CoV-2 or influenza or RSV. So that is not something that the airports are doing right now, and I think that would be a bigger endeavor to take on, to test and report the results back to every person who tests. But what they are offering is if you do the swab or you offer up that you are willing to get the swab done, they'll send you home with a free COVID-19 test. Basically kind of saying, if you think you may have this, well, at least we'll let you go test yourself. But they're not at this point in time kind of offering the option of giving you your test results. It's just an anonymous test being conducted right now.
Any last thoughts?
So having an early detection program can really be beneficial. It has shown some success. Because of this program, they were actually able to capture some of the strains of SARS-CoV-2, like the Omicron strain was actually caught through this system that was already in existence at some of the other airports in the country. So participating in it is not a bad thing. You're not tying your name to this data, so it's not any divulging personal information of any sort. It's just another number, and you're just helping them try to detect these pathogens coming in earlier in the game so that public health measures can be put out for the benefit of one and all.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.